Great, and we are live. Welcome everyone to the virtual program on the Quidditch Return to Play guidelines for COVID-19. This program is meant to go over the information that was put in the update shared on Friday. So we won't be going through the Return to Play guidelines section by section. It's assumed that if you're watching this video, you already have some familiarity with what the basic concepts are, what the requirements are, things like that. This is going to be focused primarily on what has changed and in particular what teams need to know in regards to the different requirements they have, calculating baseline conditions, that kind of thing. To start with, I want to introduce everyone who will be speaking during today's program. To start with, my name is Mary Kimball. I'm USQ's Executive Director, and I am part of what's called the post-COVID planning team, which is a joint USQ Major League Quidditch project that includes executive leadership from both organizations as well as USQ's risk management team. And I'd like to introduce three other people on USQ staff to you, Laura Porth, Megan Anderson, and Rebecca Martin. So Laura, can you kick us off and introduce yourself to everyone?
Hi everyone, thanks for joining. I'm USQ's Director of Events and Partnership. I've been working with the committee to move forward with Return to Play. Yeah.
And Megan, can you introduce yourself?
Sure. Hi, my name is Megan Anderson. I'm the Strategic Planning Manager. So part of my role is helping with Communications Department, Office of the Executive Director, and Member Services Department tasks. So part of my role with the Return to Play has been sharing updates with regional coordinator teams and kind of helping field their feedback and communicating that to the Return to Play team.
And lastly, Rebecca, can you tell people a little bit about yourself?
Hi, I'm Rebecca. I've been a risk management coordinator for about 5-6 years now. It's kind of hard to keep track. I have a master's in public health, and I've been helping with writing up the Return to Play guidelines and to keep everyone safe.
Throughout the course of this program, if you have any questions, please type them in the chat. There will be a designated time for questions at the end, and Megan will be monitoring the chat. So like I said at the top, it's expected that everyone has some familiarity already with the Return to Play guidelines. They are posted on our website. You can get to them by going to the link that's on the screen, but you can also go to our website, usquidditch.org, scroll to the bottom, there's a big button that says COVID-19, and you can go to them there. To start with, I'm going to cover the three biggest requirements of all of these Return to Play guidelines. One has been present this whole time, and the other two are new ones. So first of all USQ teams are required to abide by these Return to Play guidelines. This has been the same since the first version of this doc was posted in August. One key difference, of course, now is that under the revised guidelines, there are now 7 different stages of Return to Play, and teams can move through those stages independently by checking the baseline conditions and ensuring that they've met those and everything. And Laura and I will be covering that later in the program as well. And also the guidelines themselves are being updated to provide more clarity on how to move through those stages. The other two important things that teams need to know are new, part of the revision that was just posted about a week ago with these new stages. So the first new thing is that if your team is holding in-person events, practices, scrimmages, games, you need to submit the checklist form to us prior to beginning those activities. If your team is already, a few of our member teams have, you need to submit that form to us within 2 weeks, so by Wednesday, October 21st. If your team hasn't started those yet, you need to submit the form at least a week before your first in-person event or activity. Laura will go over this form a little bit later, but it's set up to really guide teams through the process on if it's safe and appropriate for you to be having these kinds of activities. That way there's no guesswork on the part of teams, and it also will help you get more comfortable with calculating your baseline conditions, which is really important in order for this type of more fluid return to play guidelines to be effective. The second new thing that teams need to know about is that all teams must report positive cases and certain instances of possible exposure to USQ within 7 days of that information coming to the team. So that is all positive cases resulting from in-person, or not resulting from, but involving people who have attended in-person events that your team is producing. And then there are also going to be certain times where possible exposure also needs to be reported to us. We trust team leadership to use their discretion with that. Not every instance of possible exposure necessarily needs to be reported to the league. It's ones that may have affected the team as a whole. So let's say a person was exposed at their work, went to a practice, there hasn't been a positive case result yet, and that would be an instance where team leadership, it would be required for them to report that, or recommended for them to report that to the league. And if you have any questions on any of these guidelines throughout the whole season, please email us. We can provide more clarity there as well. We're here to help teams, and the email address will be at the end of this presentation. So here is how to determine if your team can have in-person activities. So the first question your team needs to know the answer to, no matter what you're trying to do, is have there been any positive cases of COVID-19 on your team in the previous 14 days? If the answer is yes, then you must refrain from all in-person activities. You need to report that to the league, and we will walk you through the next steps. And Laura will cover that. Laura and Rebecca will cover this later in the presentation. If there haven't been any positive cases of COVID on your team in the previous 14 days, then your next step is to determine if your state meets the baseline conditions for what you're looking to do. So I'll go through that shortly. It somewhat changes based on what activity you want to be moving into. And Laura will also go through this as well later in the program. So if your state does not currently meet the baseline conditions, then you cannot begin practicing in person. You need to wait a full 7 days before running those numbers again. That 7-day period is really important. For one of the baseline conditions is about the positive case rate or a percentage of positive cases in the previous 7 days compared to the 7 days prior to that. We know that the transmission time for COVID-19 is somewhere between 10 to 14 days, sometimes longer, depending on if you're still having symptoms. So that's why that waiting a week, if you're not meeting baseline conditions yet, is really important. The next thing your team needs to do or ask yourself is if your team has submitted the baseline conditions checklist form to USQ. If your team hasn't done that, you cannot practice in person yet. Once your team has done that, then you will be cleared to practice. And once again, that form will walk you through exactly what conditions you need to be meeting. It's very clear. We'll help you communicate that information to USQ. If you are resuming in-person outdoor activities, you have to go through a similar process to move through the stages beginning in stage 2. So again, you need to first know the answer to the question about positive cases. Have there been any positive cases of COVID-19 on your team in the previous 14 days? If it's yes, you need to pause and report. If it's no, you need to have been in the previous stage for at least 14 days. And again, just like I said before, this 14-day number is really key because we want to know with moving through these stages, we want your team to have the knowledge that there hasn't been any increased risk of your team contracting COVID-19 as a result of having these in-person activities, and also that there's no increased risk to your team through other external factors. So if your team has not been in the previous stage for at least 14 days, then you cannot move forward yet. If your team has done that, then you need to check your baseline conditions for that stage. If you meet the baseline conditions, you can move up. If you don't, then you need to remain in that stage. And that's really, really critical. These guidelines are not just about moving up, they're also about staying where you are and, if necessary, moving down. Moving down is going to happen if there is possible exposure or a positive case on your team. Staying at the stage, though, that is going to happen if there is a change in your state's baseline conditions. And note, there might be instances where your team might have to go down a stage once you move into stage 5, which has a different positive case ratio than the previous ones. It has a different number there. If your team is starting with indoor events, you know, especially if you're in a part of the country where it is not feasible to have outdoor events, let's say you're a college team and you haven't even started practicing for whatever reason, maybe your school isn't allowing it, or it's just not appropriate for your team to be doing that. But let's say later in the winter, your school says that it's okay for you to practice, but it's, you know, snowing outside because you're in Iowa. You can move into stage 5 without having gone through all those other stages, provided that your team can meet these baseline conditions. This is only for indoors, though. If you are moving into stage 5 for the sole purpose of doing indoor activities, that doesn't mean you can also do the same things for outdoor activities. This is just meant to accommodate those who only have indoors as an option. So again, you need to know if there's been any positive cases of COVID-19 on your team, and you need to meet the new positive case ratio that applies for stage 5, regardless of if you're having indoor or outdoor activities. So if you're moving into stage 3 and 4, that positive case ratio is 50 and 100,000. If you're moving into stage 5, though, that number changes to 20 and 100,000. And that is because for the activities in stage 5, whether it's increasing who can come to these events and the kind of contact allowed as with indoor or as with outdoor events, or just going indoors, there is an increased risk of transmission. And so we want to make sure that the case rate in your state is reflecting a downward trend, because we want you to be practicing in a safe environment. So if your team doesn't meet this new positive case ratio, you can't begin indoor activities and you need to wait 7 days before checking again. If your team does meet that ratio and you also meet the other baseline conditions, then you can begin these indoor practices. For indoor practices, stages 6 and 7 are the same. You just increase the number of people. So if you wish to have up to 25 people at your indoor event as opposed to 10, you need to go through what's displayed in this flow chart. And this information will also be in the return to play guidelines as well. So this will be available for everyone to reference later. So next, Laura is going to talk about submitting the baseline conditions checklist and how to calculate baseline conditions for your state.
Hey, excuse me, sorry, 1 second. I'm hearing there are multiple people in the waiting room. Would we be able to let them in?
Oh, yes.
Yeah.
Okay.
Just in time for the best part.
I think I have to stop sharing my screen. 1 moment, okay? Where'd it go? Sorry, y'all. I'm trying to look at, there we go. Okay. Admit all. Hi, if you're just joining us, thank you so much for being here. You haven't missed that much. We just went over how to move through the different stages, and all of this information will be in the return to play guidelines as well on our website later in this week. So next, Laura is going to talk about calculating baseline conditions for your team, and then how to submit the baseline calculations checklist so your team can begin holding in-person events.
Hi, yeah, so to calculate the baseline, we have made this really easy spreadsheet to use to help teams navigate figuring out if they are, what stage they can be in, and if they meet the requirement baselines. So on this spreadsheet, we have figured out the population of every single state and what are the baseline numbers that each state needs to meet for 50 per 100,000 and 20 per 100,000. And Mary is pulling up right now. Great. So if you put in there's a drop-down menu to put in your state or province, and it would automatically fill in the number of cases for 50 per 100K ratio and 20 in 100K ratio for 14 days. So all you have to do is find out your 14-day case numbers for each, and it will automatically plug in where you need to be. And this is on covidtracking.com is where you can find good information on each state's numbers. So Mary, if you have can go to the sample. I think we did Massachusetts. Yes, so it will automatically calculate, if you're in Massachusetts, automatically calculate if you're able to play or not in a certain stage. So it looks like total cases, hold on. So it looks like if this number is greater or equal to 50%, your team will need to wait another 7 days. So per this, it looks like Massachusetts can play. Am I reading that right, Mary? I feel like. So yeah, it's basically, this is going to help teams. No, Massachusetts cannot play. Okay, 7,000. So this is basically going to help teams track easier, and all you have to do is just plug in these numbers, and we have done all the calculations for you. So as Mary said earlier, you'll need to submit this. If your team is already practicing, you'll need to figure out this number and then submit your form right now by October 21st. And then if you are about to practice or going to start practicing once you figure out your baseline, you will need to figure that submit this form 1 week prior to your first practice.
And if anyone wants to know the math behind how all of this works, there is a little bit more information in the data tab of that spreadsheet we were just looking at. This model is being used by the Women's Flat Track Roller Derby Association, as well as the World Rowing Federation. They're both using similar baseline conditions, and the idea of the positive case ratio came from both of those organizations. Women's Flat Track Roller Derby Association has incredible return to play guidelines if you want to read about what another sport is doing. Theirs are the gold standard into what is being put out right now to keep everyone safe. So next, Laura and Rebecca are going to talk about the importance of contact tracing and reporting positive cases to the league. Like we said at the top, this is one of the biggest changes with, or biggest updates to how we're managing the return to play process. So Rebecca, can you first talk about, from a public health perspective, why contact tracing is so key to an approach like ours?
Yes. So contact tracing is really important in just mitigating the spread of disease. So if, someone is exposed to the coronavirus, they need to know that, because they need to help. They need to know if someone needs to know if they're exposed to coronavirus to prevent themselves from spreading disease further. So let's say teammate A has coronavirus, everyone else needs to know that so they can quarantine and prevent themselves from spreading it to their coworkers or their family and their friends, because that's how you get outbreaks, is people who are exposed don't know they're exposed, or sometimes they know they're exposed and they don't care and go out into the community and spread it. And that just really limits, that is the way you, and so contact tracing is really how you keep a cap on the spread of disease, because if people self-isolate then and are responsible to the community, then they won't be spreading the disease to the community, which will result in maybe further lockdowns, more cases, and just not being able to go out and do things you want to do.
Yeah, it's absolutely crucial for an approach like this. Next, Laura is going to talk about how to report a positive case or an important instance of possible exposure on your team, and how USQ will support you after that form gets submitted.
Yes, so Megan has LinkedIn, and on the screen you can see the link for submitting a positive test result, or if one of your teammates has been in contact with someone who has tested positive. So you'll need to submit this form within 7 days of the contact or the positive test. And this also you can find on our website as well, in the return to play guidelines on the COVID page. So you have simple, easy form, all the information. And once you submit this form, one of our staff members will be in contact, and we will help you move through the quarantine and isolation process and the contact tracing to make sure that everyone who has either been in contact or was at that practice or that event either quarantines or self-isolates. So USQ will be here to help guide you through, because we know it will be a difficult time. If a, let me get to my notes. If a team has, if you have submitted this form and someone has a positive case or been in contact with someone who has a positive case, and it affects the entire team or majority of team, like they went to a practice, that team will you'll need to go down to stage 0 in the return to play guidelines, which basically means no in-person activities. And you will need to stay in stage 0 for 14 days. And so during this time, no activities, no practice, only just virtual meetings, if anything. After the 14-day period, your team will be allowed to resume activities at stage 2, which is no contact and only 25 people in an outdoor setting. After the additional 14 days, another 14 days, your team will be allowed to return to the stage they were at prior to the positive case. So if your team was at stage 5 and you have someone test positive, after basically 28 days, and no additional positive cases, you can return back to stage 5 and return to play and in-person events. But once again, once you submit this form, USQ will be here to help guide you through that entire process.
And one thing to note, if you are a part of a college team, your school may have additional reporting requirements for something like this. So please be sure to also be following your school's reporting guidelines because it's incredibly important to also help them manage what's happening on campus. So that concludes everything that we wanted to cover with the important updates that were made last week and everything like that. So now we want to open it up to questions from the audience. So this can be about information that has been covered in this program, but also if you have a question about something else in the COVID-19 return to play guidelines, we can also answer that. That's why we have all 4 of these USQ staffers here at the meeting. So you can either type your question in chat or you can unmute yourself and ask it.
I have a question. Who at USQ can a player reach out to if they don't have access to testing, like states where the capabilities are low for school-based testing, or testing can only be gotten through a referral from a provider? Does USQ have any support for that or a plan in place?
We do not. However, we can help the team or the player look up resources in their community, as well as provide them with information on other things that they can do in the meantime if they think that they might be experiencing symptoms of COVID-19. This is partially why we have part of the requirements for reporting being possible exposure, because not everyone has equal access to testing around the country, like for the reasons that you mentioned, Jeremy. That's just some of the restrictions. So it's important that people read through the sections on the symptoms of COVID-19, and you do not need to have a positive test result in order to trigger your team needing to quarantine and isolate. We can help support the team through that process with, again, looking at the symptom list and notifying everyone and making sure that the team stays safe. But for who they can reach out to for that, I recommend that they email membership@usquidditch.org, and we will make sure that the question gets to the risk management team. And Rebecca used something to add about this as well.
Yeah. So, and adding on to that, if you have a primary care provider, you can reach out to them and they should be able to direct you, or you can look up your local, or yes, your county or your state health department. Probably just Google county name, state health department, and they, as far as I'm aware, most, if not all, counties have something on the coronavirus, COVID-19, just like what phase they're in and testing centers, so you can look that up as well. And I also looked up just to see what other resources were available. I'll put the link in the chat. HHS has some resources on how to find community-based testing sites, and we can try to make that link available. We can, make that available as a resource to teams that have more questions. But so it has pretty good guidance on different places you can call, and yes, so you can try that. We can help guide you as well.
And thank you, Rebecca. That's a great resource as well from the Department of Health and Human Services. And what other questions do people have?
In terms of the form, the checklist form and everything like that, is that including, like, do we send it in for stage 2, doing the non-contact, like still in person but non-contact, under 25 people practices?
Yes. Yeah,
okay.
we want all teams to do that because we want to start to get a list of who precisely is doing in-person events. That way, we can make sure that your regional coordinators know, so they can check in with you every once in a while, see how things are going, and also we might want to have our risk management team check in with you, be able to send you updates directly, that kind of thing. It just helps us with communication.
Yeah, absolutely. I just wanted to clarify because oh, sorry. Yes, thank you. That does answer my question.
Awesome. Are there any other questions?
Sorry, one more about this form.
Yeah.
In terms of sending it, do I just, fill it out electronically and send it to membership or gameplay?
Yeah.
Okay.
Well, there's a new Google form. We made a form that's a little bit easier to fill out through Google. So it's essentially what's in the return to play guidelines right now, and we'll be updating that PDF with that link later this week. You
Okay.
can either submit what's currently in the appendix, or you can go to the Google form that we linked in the presentation, and that I think Megan put in the chat as well. I can also drop it in the chat if that's helpful. I think I can probably pull up the link.
Okay. Yeah, I just see for the guidelines, and then
Yeah, let me pull.
Here, Mary, I have it easier. I have it up right now.
This link in the chat should take you to the new checklist form. Let me also see if I can pull it up on my screen, and then I can walk you all through how it works. Okay, so everyone should be able to see this now. This is a Google form version of what was originally Appendix A. USQ uses a lot of Google Forms already, and so, in prepping for this program, getting feedback from regional coordinators and everything, we felt like this form would be a more accessible way for teams to start to get this information to us. So this form initially just asks for team contact information, asks if your team has begun holding in-person events already as of October 5th, and then we start by asking this question on if there's been any positive cases. If there have been any positive cases on your team, if you answer yes, it will take you to a page that says basically you can't submit this form right now, and it'll have you acknowledge that you understand that you need to wait at least another 7 days before trying to host your first, or in the case of some teams, another in-person event. And that's the logic throughout all of this form. Depending on if you answer yes to no to specific questions, it will either let you proceed or say, I'm sorry, you need to wait another 15 days. So just trying to make it as straightforward as possible for teams to understand the requirements and give us the information we need.
awesome. It currently does, though, say that when I click on the link, it says you need permission and that the form can only be viewed by users in the owner's organization.
I will fix that after this presentation. Thank you for pointing that out. Yeah, so for anyone looking at the form now, after this has been posted online, the permissions have been updated. They're just not updated in this moment right now. Are there any other questions? Would it be helpful for us to go through any other aspects of the return to play guidelines while we have everyone here?
Tracy.
Could you just go over that spreadsheet again, or using it?
Yeah. Yeah, so I'll start, I'll explain the sample first, and then I'll walk everyone through how to do it for the state that I'm located in, which is Washington State. So the sample looks at the state of Massachusetts. And once you select your state, then the case numbers, Amount of new cases allowed in a 14-day period, those numbers are going to pop up. The first number is for the 50 and 100,000 ratio. The next one is for 20 and 100,000. And this is the baseline that you're comparing your state's numbers to. So these numbers do not change. They're based on your state's population as of census data, I believe from last summer. So this is partly why we made this for teams, just so you didn't have to go looking up the information. So the next step, once you've selected your state, is to plug in case numbers. So there's a column to add in the dates that you're looking at, and then to type in the number of cases. So if this value at the end, if this is greater than one of these numbers, depending on what stage you're trying to move into, then that means your team hasn't met the baseline conditions and you need to wait at least 7 days before running these numbers again. The other thing to note, like Laura mentioned, there's another condition you need to look at, and that is if there's been a 7-day increase in cases. So this is also auto-totaled for you. So it will take these case numbers and calculate the percentage. So if there's been, if this number is greater than 50%, then your team must wait another 7 days. If it's less than that, or if it's negative, which means there's been a downward trend in new cases, then your team is rated to practice. So this will help you calculate both those baseline conditions. One other thing to note is that if your team is trying to move into a stage where inter-region play is allowed, so you're, let's say you're based in California and you want to play a team in Arizona or something, or as we have in the example, this team is based in Massachusetts, they're going to be traveling to New York. You also need to calculate that information for the state you're traveling to. So it's exactly the same process, you just fill in the cells that are highlighted. So for doing that on your own, so you can already see I selected Washington, and these are the max number of new cases I can have per my state's population. Then to get that information, you go to, we recommend that people go to covidtracking.com. One thing to note is that depending on your state might already calculate this number for you. For example, Washington State's coronavirus website puts the rate of cases per 100,000. Not all states do it, and that's why we provided this spreadsheet. Like, for example, the state of Ohio looks at cases over a 21-day period in their COVID tracking, which doesn't map with our 14-day standard. So that's why we're having people look it up, because there's a little bit of inconsistency in what states are reporting. So you go to covidtracking.com, you click on your state, and then you go to historical data, this little link right here, and this is going to give you daily totals. So you're going to want to look at the number of new cases in the previous 14 days. So I'm not going to copy and paste all of it because it does take a little bit of time. But if you just start to type it in here, I apologize, it appears that my keyboard has decided to stop working. If I were to type in the number from today, 387 cases, then that total would appear at the bottom. So you just need to fill in this information, and then the spreadsheet will auto-calculate everything for you. Do you have any other questions? Does that go over it pretty well?
Yeah, no, thank you so much. It's just Excel sometimes beats my brain a little bit.
I totally understand. If it helps, you can make a copy of this Google Sheet and use it that way. I personally find Google Sheets to be a little bit more user-friendly than Excel, but if you download it in Excel, it will absolutely still work.
Okay, awesome. Thank you.
Yeah, and also people can also reach out to their regional coordinator to get help with this. You can set up, like a Facebook chat or a video meeting or something, and the RC can help you get this data as well if you're having tech challenges. To use this spreadsheet yourself, you do need to make a copy of it. This is so that we don't have, 150 people or something trying to all enter in data at the same time. So to do that in a Google Sheet, you click File, and you're going to hit Download if you want it to be in Excel. You can also make a copy, and if you make a copy, that will go into your own Drive account, and then you can manipulate this and figure out the totals yourself. Is there anything else that people would like us to go over? Great. So just to wrap up, please visit the USQ website for up-to-date information on COVID-19, what's happening with programs and events, and return to play guidelines. The next update on these guidelines will come no later than December 1st. And during the month of December, we will be working with regional coordinators to get more information from teams on what restrictions they might be facing for participating in spring events. And also as a reminder, USQ official and sanctioned events will not be taking place until January 1st of next year at the earliest. So that means that should we get to a point where teams are having games, that they would be entirely unofficial, because nothing will count for the standings until the beginning of the year, pending it being safe for us to do so. So on that note, thank you all so much for joining us. I hope you found this valuable. If you have any further questions, please reach out to us. Email is going to be the best way to get your question answered, but you can also send us a DM through social media. You can also contact your regional coordinator. They are a fantastic resource. If you have a question that is more medically oriented, like if you want to know more about the science side, public health side, anything more about the symptoms, that kind of thing, you can reach out to Rebecca directly. Her email is on our website. You can also reach out to anyone else on the risk management team. But again, if you email membership@usquidditch.org, we will make sure that your email gets to the right place and that it will be promptly answered. Thank you all so much. I'm going to stop the recording. Okay, if I can figure out how to do this. Oh boy, what an end.